Hi there, it's Tammy here. And in this short video, I'm going to be talking about pregnancy weight gain and the Goldilocks effect. So if you feel that weight gain during your pregnancy is a challenge for you and you want to navigate this transformative time in your life in a way that positively influences your maternal metamorphosis, then this video is absolutely for you. So let's talk weight gain and pregnancy. And I'm 99.9% sure that most women watching this video has either struggled with this or at least thought about it in some way, shape, or form throughout their pregnancy journey. Now, when it comes to having a healthy pregnancy, you can't really get away from the fact that you're going to gain weight. You need to gain weight. But like Goldilocks and the porridge, too much and it's unhealthy, too little is also unhealthy. It needs to be just right. But finding that sweet spot and being happy in it can actually be very, very difficult. I totally get that, right? I mean, it's hard enough in our everyday lives to manage our weight ongoing or like weight gain, let alone during pregnancy. And even for those that manage to balance this tightrope just so, there's no denying that it's a balancing act that requires a lot of mental flexibility as the scales go up. I mean, it was just yesterday that I was getting coffee from one of my favorite coffee places in Bondi, and the barista, who I've known for years, was asking whether I'm getting a lot of kind of New Year, New You inquiries, right? Because it's kind of January as I film this. And even though he knows that I'm a coach and we've had many conversations about training and lifestyle over the years, I don't think I've ever actually told him that I was a pregnancy and postnatal specialist strength coach. So of course, it just so happened that when I mentioned that I'm a pregnancy and postnatal specialist, and my market doesn't really tend to have massive New Year, New Me spikes, of course, the first thing that he tells me, which is amazing, was that his partner was pregnant. So that was really cute. So congratulations. Now, in the course of this brief conversation, while my delicious coffee was getting made, the topic of his partner actually struggling with the weight gain and body image aspect of pregnancy came up. Now, he brought that up. I just need to be clear that he brought that up, not me. I did not mention that. He brought it up. And of course, while I do live in quite an image conscious part of Sydney, being in Bondi near the beach, I actually don't think that this aspect of pregnancy is limited to areas close to urban beaches like Bondi. You know, body image and weight gain are topics that many women are very intimately aware of. I mean, they likely came into our consciousness somewhere between the ages of 5 and 11. And can you even believe that research done by the National Organization for Women shows that 46% of 9 to 11-year-olds are sometimes or very often on diets? I mean, isn't that insane? So it's really no wonder that weight gain and body image during pregnancy can be such a difficult path to navigate. You know, if we go by those statistics, we've been trying to control, manage, or change our weight since before we were teenagers. And here we are now pregnant, trying to gain weight. Talk about pregnancy being a 9-month state of cognitive dissonance. You literally need to hold two different conflicting ideas in your head at the same time. You know for your health and the health of your baby that you need to gain weight, but you've likely spent your whole life trying not to gain weight. I mean, mind blown. Now, sorry. Now, I'm going to talk about a study on mass media, body image, and eating disturbances now, which has actually shown that in affluent English-speaking societies, slenderness is generally associated with things like happiness, success, youthfulness, and social acceptability. And being overweight, these are their words, not mine, is linked to laziness, lack of willpower, and being out of control. Again, this is a study, those are their words, not mine. So if slenderness is associated with success, youthfulness, and social acceptability, and being overweight is, their words not mine, linked to laziness, lack of willpower, and being out of control, Again, I do not think these things. I'm just following the research. So it's actually no wonder that so many pregnant women talk about feeling out of control of their bodies, like they've scored the lead role in Tale of the Body Snatchers. Add that to the increasing influence of things like social media in our world over the last decade, it comes as no surprise that pregnant women are feeling more and more pressure to look perfect at a time when so very few actually feel the very best version of themselves. And I think the big question is, how do you navigate this transformation in a way that positively influences your maternal metamorphosis? And firstly, I think that it's important to understand what body image actually is, right? So body image has been defined as the picture of our own body, which we form in our mind. So that's to say the way in which our body appears to ourselves. So our body image is a psychological phenomenon, like I get that it's one that is significantly affected by things like social media and other social factors. But body image is the picture of our own body, which we form in our own mind. So that is to say the way that our body appears to us. And it's a psychological phenomenon. And the psychological phenomenon is key here because knowing that it starts in your mind is critical to the understanding that, like most things to do with the mind, it can be changed. It's not fixed. And I also believe that understanding where the weight gain actually comes from and how the body's shape is changing as the pregnancy progresses is the first step in making it easier psychologically when you see the scales increasing over time. Because unlike typical weight gain, you're not just putting on body fat here, and the weight gain certainly doesn't mean that you're going to give birth to a 10-kilogram baby. I mean, heaven forbid, imagine that. Sorry. But understanding how the body shape changes, or more specifically, how the hips and rib cage change or widen during pregnancy is also another factor, and it's important, right? And I was literally just a few hours ago having a conversation with a pregnant client who's pregnant with twins, because she was actually commenting or potentially lamenting on the fact that her hips have increased in size along with her booty. I don't think that's a bad thing. But interestingly, the research has shown, and yes, they have done research on this, that waist to hip ratio increases directly correlate with fetal growth. In fact, a 0.1 unit increase in your waist to hip ratio predicts 120 gram greater birth weight, a 0.2 inch greater length, and a 0.3 centimeter greater head circumference. So your ribs and hips widening to make room for the baby are beautiful signs that your baby is growing, which is exactly what you want it to be doing. And in order for your baby to grow, you also need to grow and change along with it, which is beautiful. You're together as a dyad. So what about pregnancy weight gain? What actually makes up the pregnancy weight gain? Because I think this is really important, right? To help you understand what all this weight means, what these figures mean. And the figures that I'm about to share with you are an estimate based on approximately 13.5 kilograms of weight based at the time of birth. And pretty much from all the pregnant clients that I've trained over the years, who have trained consistently throughout their pregnancy, and based on their weight a few weeks after giving birth, these figures actually ring pretty true to me. So the average baby's weight is about 3.4 kilos. The average fat stores that you put on are 3.1 kilos. You have about 1.8 kilos of extra body fluids, about the same as blood. You have about 0.9 kilograms of breast enlargement, same as uterus enlargement, and amniotic fluid, so all 0.9 kilograms, as well as about 0.7 kilograms for the placenta. So let's just recap on the fat stores part here. It's 3.1 kilograms. It's not 10 kilos of body fat gain here, but 3. And remembering there's an emphasis put on how much weight is gained during pregnancy due to the health perspective for both you and your baby, with multiple sources of research showing that the risks of problems developing during pregnancy and delivery is lowest when weight gain is kept within a healthy range. So from a headspace perspective, it's really important to make the shift from an aesthetic perspective to a health perspective, from a singular you perspective to a greater we perspective, you know. So just think aesthetic to health, you to we. Now, of course, there are guidelines to what healthy weight gain during pregnancy should look like, right? And of course, these are all based on your pre-pregnancy BMI. But pregnancy weight gain is not linear. Every single body and how they gain weight is different. And I think the best way to look at these guidelines is from an overall perspective. As you know, some women will actually reach their recommended weight gain earlier and then hold steady. So their curve might look like that, right? Some may stay on the lighter side and then increase rapidly towards the end of their pregnancy. And, you know, others may be just kind of slow and steady throughout the whole pregnancy. Nothing is linear when it comes to weight gain during pregnancy. And of course, your overall health and well-being practices will help determine the overall overall amount of body fat gained throughout your pregnancy, the overall weight gain, right? It's likely that they won't determine how your weight gain progresses over the course of your pregnancy, but it will help determine what that body fat gain percentage looks like. And like I've said, I've trained women from pre-pregnancy and trained them all the way through their pregnancy, and their weight increased reasonably quickly at the beginning, then plateaued for essentially the rest of the pregnancy to the last few weeks, where it again increased, right? Now, obviously, if you don't exercise and you eat for two, you're going to gain more weight than someone who is training consistently, making educated decisions around their nutrition, thinking about portion sizing. But that's not what I'm talking about here. So unless your starting point was already unhealthily underweight or overweight, or you're at a risk of developing a specific health problem, the next question you might want to be asking yourself could be things like, to weigh or not to weigh? Do you even want to know how much weight you're gaining during pregnancy? Yes, it's an important health factor. However, if it's going to affect your mental health, how important is it really? I know for me, I'd much rather go by how I feel than base how I feel on the number that a set of scales gives me, right? And I know some obstetricians that don't even weigh their pregnant clients. For me, in a coaching capacity, weight isn't really something that I ever really bring up, very rarely. Pretty much. In my opinion, other health indicators are just as important, if not more important, and I prefer to lead with these types of questions and look at overall health, things like how are you? How are you feeling? How's the body feeling? How's training going? How's your overall nutrition? How are you sleeping? Are you drinking enough water? For me, these things are so much more important than what a number on a scales is telling you, and give you a better picture of your overall health. And the perspective that you have on your weight gain during pregnancy is key. And a positive way to achieve this could be seeing your pregnancy as actually an ideal time to heal old or faulty thought patterns or patterns of behavior relating to your body image and how you control your weight. Because the reality is, as pretty much as women, most of us do try to control our weight in some way, shape, or form. And a great example of this might be if you feel like your whole life has been one big diet and you weigh yourself religiously, you could actually use your maternal metamorphosis as a time to heal these behaviors and the thought processes that drive this behavior, the thought processes behind them. And I believe this would be an extremely positive pregnancy outcome. I also believe that this path is especially important if you're having a girl, right? especially when research shows that 5-year-old girls, their ideals about dieting are predicted by their mothers' dieting, and girls whose mothers report current or recent dieting were more than twice as likely to have ideas about dieting already, and that's by age 5. And we probably need to start ending that cycle, right? And at the end of the day, when it comes to pregnancy weight gain, you have a choice to make. You can either continue to try to control and fight against your weight, or you can choose to work with it and embrace the physical changes that are happening within you, within the maternal metamorphosis, as you step into a new version of yourself. And personally, I believe that there are 4 core pillars of health that make up the process of not only working with, but embracing the changes that are happening in your body during pregnancy. And they are education around what's actually happening to your body during pregnancy. And of course, training, because when it comes to pregnancy, you should absolutely 110% be training. And for many, many more factors than just weight management, right? There's so many more benefits to training during pregnancy than just managing your weight. You can't forget nutrition education, because understanding what your body genuinely needs during this time, how to adequately fuel your body with the right food sources, the right portion sizes, and what, vitamin and mineral and nutrient sources it requires is vital when it comes to your overall health and the health of your baby during pregnancy, not just managing your weight. And of course, you can't forget looking after your mindset at the same time, because part of navigating this transition positively is about holding the correct frame in your mind that all of these changes happening to your body are about more than just a number on the scale. And when it comes to positively navigating the maternal metamorphosis, these things, the things like the education, the mindset, the training, the nutrition, they don't exist in silos. They are not separate from one another. They coexist together, and you need each pillar across the 4 different trimesters, because there's just so much change in each. And this, of course, is the base of the pregnancy process program. And it's certainly something that I don't believe that you can find following, things like generic swipe to train social media workouts, or, the generic trimester-based YouTube pregnancy workouts, Either way, these changes are going to happen. And ultimately, it's you who gets to decide what path you're going to take. But I advise you to choose wisely, because the parts of yourself that you choose to take with you can actually directly influence your future child and their ideas, concepts, behaviors, and beliefs around dieting and body image. So if you want to follow a path that includes education, mindset, training, and nutrition, head to the link in my bio or in the video description and apply to join my complimentary but private community. So that's it from me today. I really hope this video helped, and I'll see you in the next one.